Hi everyone. This animation is designed to give you a quick introduction to the GW4 Menstrual and mental health research community. Hormonal fluctuations and physiological symptoms associated with the menstrual cycle are likely to form complex bidirectional associations with mental health that could also interact bidirectionally with external environmental and social factors. The GW4 Menstrual and Mental Health Research Community was established to help fill gaps in research at the intersection of menstrual and mental health. We're a group of academic and clinical researchers from a wide variety of disciplines, so things like epidemiology, genetics, psychology, policy studies, and feminist theory. We want to combine our expertise and our perspectives to conduct interdisciplinary research that aims to answer the most important questions around menstrual and mental health. And we want to use the best methods and approaches to conduct research that will benefit women and people who menstruate. To make sure that we get this right, we want to work with research stakeholders, that is, someone or an organisation that would benefit from or could inform our research. Through online workshops and discussions that we've had already, we've identified 5 main areas where we have expertise and research interests, and now we want to know what you think. Are these the right questions to be asking? Will our research be as useful as it can be? So number 1, we're interested in the best ways to measure and characterise mental health over the menstrual cycle, and this includes studying the physiological and emotional symptoms that make up premenstrual syndrome or PMS, and the cyclical mood disorder premenstrual dysphoric disorder or PMDD. A better understanding of the mechanisms linking the menstrual cycle to mental health could have important implications for the way people suffering from PMS and PMDD understand their health and bodies and how they are treated in a medical setting. So our preliminary research questions in this area are firstly, when and to what extent do physiological and emotional symptoms fluctuate throughout the menstrual cycle, and how best can we measure and analyse these changes? Are effects of the menstrual cycle on mood or psychological distress mediated by effects on physiology, so things like inflammation, pain and anemia? Are effects stronger or weaker in different social, political and cultural contexts? And for people with symptoms of PMDD, what are the barriers to diagnosis? So what symptoms do people present to their doctor with? What are they diagnosed with prior to getting their PMDD diagnosis? How long does it take them to get that diagnosis? What are the demographic characteristics of the doctors that do or don't diagnose PMDD? And how do PMDD patients feel about their pathway to diagnosis? Number 2, we're interested in early experiences of periods in adolescence and the role of sexual and reproductive health education. So around the time of the first period, or the menarche, there are huge hormonal changes that affect physiology, anatomy, and mood and mental health. Social stigma and taboo around menstruation can give rise to early negative feelings and negative menstrual experiences, which could act as a blueprint for future experiences. So quality, well-timed education at this time for both menstruating adolescents and their non-menstruating peers might help to reduce confusion and stigma and improve mental well-being. The average age at menarche varies significantly by geographical location and demographic factors, and experiencing menarche at a younger than average age has been linked to an increased risk of depression in adulthood, but the mechanism is unknown. So it could involve a biological predisposition, but psychosocial factors and experiences in adolescence are also likely to play a role. So our preliminary research questions in this area are: how does timing of menarche influence risk of poor mental health in adulthood, and can earlier, more widespread and better quality sexual reproductive health education mitigate this impact? What impact does the timing and quality of school-based education have on mental health during the transition to puberty? And we're also interested in what young people might be learning outside of school. So we're interested in how the public understands menstruation and the reproductive life course. Number 3, the other end of the female reproductive life course is marked by the cessation of menstruation at the menopause. Hormonal changes around this time result in a wide variety of physiological, emotional, and cognitive symptoms, including hot flushes, feeling anxious, irritable, depressed, and poor memory. Recognizing and understanding the link between menopause and mental health is really important for helping perimenopausal women and their families and friends make sense of these changes, which are often completely normal and do not indicate any kind of pathology, but can nevertheless be distressing. If healthcare providers were better able to predict which women were most at risk of experiencing mental health issues around the menopause, they might be able to offer extra support to them. And if we knew more about the biological and social factors that cause some women to suffer with their mental health at this time, then this could help in the development of new treatments and strategies to lower women's risk and improve their mental health. So we're interested in addressing the following preliminary research questions. Firstly, what are the predictors and causes of poor mental health around the menopause? And also, what is the impact of the menopause on cognition and dementia? Number 4, symptoms of menstrual disorders such as endometriosis or unexplained abnormally heavy or painful periods can be associated with lower quality of life and well-being, as well as non-attendance at school and work and higher rates of mental health disorders. Stigma and a lack of knowledge about what is normal means that menstrual disorders are often underreported and underdiagnosed, but they affect a large proportion of the population. The association between menstrual disorders and mental health is likely to be extremely complex, involving interactions between genetics, reproductive hormones, and other physiological processes, but also environmental factors, including health behaviours and social, political, and structural influences on health and well-being. Additionally, we already know that psychological stress can impact the menstrual cycle, causing changes to features like heaviness of bleeding and regularity. So the relationship between menstrual and mental health is likely to operate in both directions. Our preliminary research questions around menstrual disorders are people who experience problematic menstrual symptoms at a higher risk of mental health disorders? And does this represent a causal effect? And also, is any association better explained by genetic or physiological factors like inflammation or social environmental factors that can explain both menstrual symptoms and mental health? Number 5, we're interested in menstrual health management. Access to safe, clean facilities, affordable menstrual products, and sexual and reproductive health care are hugely important factors in shaping people's experiences around menstruation. And unmet menstrual health needs can have significant impacts on mental and social well-being. Availability, accessibility, and affordability of menstrual products and healthcare services that support menstrual health will be relevant to all of our research. So for all of the research questions I've previously mentioned, we will consider whether our findings vary by socioeconomic, demographic, and cultural context. The GW4 Menstrual and Mental Health Research Community was initially funded by the GW4, which is an alliance of 4 of the most research-intensive and innovative universities in the southwest of the UK, in Bath, Bristol, Cardiff, and Exeter. Currently, our community is mostly comprised of researchers from these institutions, but we're keen to expand to incorporate other multidisciplinary perspectives and experiences. So if you're a researcher or a research stakeholder and you'd like to join us, Or if you'd just like to give us your thoughts on our research ideas, then please get in touch, either via our Twitter account at GW4MMHRC or by emailing me, Gemma Sharp, at gemma.sharp@bristol.ac.uk.